5 hospital traps seniors fall into, and how to protect yourself. When individuals aged 65 and older check into a hospital, they often encounter routine paperwork. However, it's crucial to be aware that some hospitals are utilizing legal avenues to potentially turn a standard admission into a significant financial burden or even hinder access to necessary rehabilitation care. This information aims to clarify 5 common pitfalls that seniors can unknowingly fall into when seeking medical treatment, and provides essential phrases to safeguard both health and financial well-being. The pattern observed is not due to a lack of dedicated medical professionals, but rather systemic aspects that can unexpectedly impact seniors' finances and recovery processes. These potential issues are prevalent and affect many, often because individuals are unaware of the right questions to ask. One particularly surprising trap involves the out-of-network specialist surprise. A senior might meticulously select a hospital, confirm it's within their insurance network, only to later receive a bill for services rendered by a doctor they never directly engaged with. This can happen because while the hospital itself may be in-network, the individual specialists working within it, such as anesthesiologists, radiologists, or emergency room physicians, might operate under separate contractual agreements and be out of network. Consequently, the patient becomes responsible for these charges. While a federal law, the No Surprises Act, was enacted to protect against such situations, its provisions are often underutilized due to a lack of awareness. To protect against this, a clear statement can be made upon arrival at the hospital. I only consent to treatment by in-network providers under the No Surprises Act. This simple declaration puts the facility on notice, shifting financial responsibility back to them if an out-of-network provider is involved without prior consent. Another significant concern is premature discharge, sometimes referred to as rehab dumping. Hospitals, operating under financial pressures to manage bed capacity, may encourage patients to leave before they are medically ready. A doctor might state, "You're doing well enough to go home," leading many to comply. However, this can result in readmissions and greater costs if the patient is not fully recovered. Medicare patients have a legal right to appeal a discharge they believe is too soon. This appeal can be initiated through a local quality improvement organization, QIO, found via Medicare.gov. While an appeal is being processed, the hospital cannot legally discharge the patient. The key is to know the phrase to use. "I don't feel medically ready for discharge, and I am requesting an expedited appeal through the QIO." Prior to even reaching the hospital, a potential issue arises concerning medication management. Hospital pharmacies often operate with a specific formulary, an approved list of medications they stock. Essential maintenance medications, carefully managed over time, may not be on this list. Hospitals may then substitute these medications with different brands or generics, sometimes without clearly informing the patient or even the admitting physician. For individuals, especially those with cardiovascular sensitivities, such changes can lead to adverse health effects, including dizziness, blood pressure fluctuations, and irregular heart rhythms. Furthermore, these substituted medications may be more expensive. To prevent this, it is advisable to maintain an up-to-date written list of all medications, including exact brand names, dosages, and timing, and to present this list to the admitting doctor with the explicit instruction, "Do not substitute or alter any of my maintenance medications without an explicit clinical review and my written consent." A particularly financially impactful trap is the blanket financial responsibility form. Upon admission, patients are often handed a stack of documents, including forms that, buried within their text, state that the patient assumes financial responsibility for services not covered by insurance. Signing this without fully understanding its implications can grant the hospital the right to bill patients directly for inflated rates that insurance companies would typically negotiate down. This practice, known as balance billing, can lead to substantial out-of-pocket expenses. To protect against this, when signing any financial agreement, it is recommended to write next to your signature, "Signing only for authorized insurance benefits, not personal financial liability for uncovered balance billing." The most significant financial trap, however, is the observation status designation. A substantial number of Medicare patients are admitted to hospitals under this status, which technically classifies them as outpatients even while receiving inpatient-level care. This is critical because Medicare Part A, which covers extended care such as rehabilitation, requires a formal inpatient admission of at least 3 consecutive days. Observation status does not count towards this minimum. Consequently, a patient who spends several days in the hospital under observation and then requires subsequent rehabilitation may face significant bills for the entire hospital stay, as Medicare does not consider it an inpatient admission. The crucial question to ask upon admission is, am I admitted as an inpatient or am I under observation status? If the answer is observation status, the appropriate response is, I am requesting that my status be reviewed for formal inpatient admission based on medical necessity. Hospitals are also legally obligated to provide patients with a written notification of their observation status, known as the MOON Notice, Medicare Outpatient Observation Notice, within 36 hours of arrival. Inquiring, "Have I received my MOON Notice?" demonstrates awareness of these rights. To effectively navigate these potential issues, it is essential to have these key phrases readily accessible. Writing them down or saving them on a phone can serve as a vital hospital protection plan. Regularly reviewing these phrases before any medical appointment or visit to a healthcare facility can help establish a protective habit, ensuring that individuals can leave hospitals with their financial resources and recovery prospects intact. Further understanding of post-hospital care, such as rehabilitation and skilled nursing facilities, is also crucial, as this constitutes the next phase of the healthcare journey where similar financial and medical considerations may arise.